All right, good morning, everybody. Everybody's been asking me since I talked about the self-proclaimed doctors and surgeons in that last video I did about what's inside this bag. All right, so this is my bug-out vehicle medical pack. All right, before I open this up, before I go any further with this video, let me make this clear. I am not a medical professional. This is not by any means any medical advice. You should always, of course, seek proper medical training and advice from a professional before attempting any kind of first aid. All right. Now that that's out of the way, let me tell you what's inside here. Well, before we get inside, let me say one more thing. Okay, this is my bug-out vehicle bag. Okay, so this stays in the truck at all times. All right, I wasn't overly concerned about weight. Uncle Al, if you're watching this, I'm sure you are. I will weigh it at some point to give you the weight because I know you were curious. But the reason I wasn't overly concerned about weight is because this stays in the truck 100% of the time. In the event that I need to abandon my vehicle, right, because I say all the time, I'm bugging in unless I have to bug out. And if I bug out, I'm going to another location, in which case this bag is to keep me and my family and maybe those along the way safe and out of danger, and to help us in the event of something happens while I'm in my BOV, or while we're staying over someplace, or if we break down, okay, or if I got to help somebody along the way. If I got to abandon my BOV, I have a medical kit in each one of my bug out bags that would come with me, my wife, and the children. Okay, there's a trauma kit and a regular first aid kit in each bug out bag. So this is not designed for me to just haul on my back and take with me, but it's designed to keep in a bug out vehicle. And so if I have to move to an auxiliary bug out location, that I have a med kit that I could take with me, and I could treat any injuries that may occur at the new bug out location. All right, so let me get into it. Let's show you what I got going on. We'll go into the main compartment first. Oh, look at that. Tons of goodies in there, right, guys? All right. So this is what we got now. I'm not going to pull everything out because it's just not worth me putting it all back in. First thing, right towards the top, okay, this is an all-in-one CPR respirator mask. I'm not going to pull it out of the package, but I'll show you guys what it is. Just like that, it's got the gloves, it's got the CPR mask. In the event you have to give somebody CPR, try to keep yourself from, keep yourself safe when doing CPR, let's say that. Top here, I got Coflex, I got medical tape. I got my large, I'll show you here. Let me pull this out for you guys. I'm not going to pull it all out, but these are my large so-called trauma dressings, larger gauze pads. These are 6x6, what 6x6 dressings, surgical dressings. I got these here are 4x8s. I got the 6x9s abdominal pads. And then, of course, I have a big bag of alcohol prep pads. I kind of just stuck them in there because that's where they fit. All right, so that's where all my larger gauzes, larger gauze, excuse me, my larger dressings, okay? I have everything down to these here. All right, I got 4x4.5s. I got all different sizes of large dressings to treat different wounds, okay? Center pouch here, this is all rolled gauze, all different size, from small to large, okay? This whole compartment here is all different size ACE bandages, okay? I got them literally all different sizes, all right? Now, ACE bandages are great for a lot of things, from sprains to help and use as additional compressing dressing over gauze. They really come in handy for a lot of things, so I keep a lot of them. Now, let me just, before we get into the gauze in a second, while we're on the topic of gauze, I want to bring up a point. I've talked about this in the past. The reason you'll see a lot of us stock so much gauze, guys, all right, rolled gauze and gauze pads, which I'll get into that in a second, is that when you have a traumatic bleeding situation, you will go through more gauze than you will ever imagine. It's out of control how much gauze you will go through. So keep that in mind. There's a reason why we stock a lot of gauze, all right? Over here, in this little compartment here, I keep actually an antiseptic oral mouth rinse. It's a prescription oral mouth rinse. Believe it or not, people seem to not consider that when they think about a first aid kit, but if you run into a situation where you come across somebody that's got some gum disease or gingivitis and stuff like that, that can lead to other infections in the jaw, and actually stuff that can lead to heart problems. So I keep that in here as well. Hydrogen peroxide, 50% rubbing alcohol. In this here, I keep an antiseptic wound and hand cleanser. Okay, and I actually keep in here, these are saline, injectable saline. All right, for flushing IVs. I'm not going to get into that right now, but that's what that is. Okay, in the front here, I have stuffed in here, okay, hospital socks. I have ankle, knee, and wrist supports. Okay, hospital socks, because you lose a hell of a lot of body heat through your feet, your hands, and your head. Of course, you know, you lose it all over the place, but your feet and your hands and your head. If you got somebody that's really sick and they're really feeling cold and ill, trust me, it make a world of difference to have those socks, and they got the no-slip grips on them. All right? So that's the main compartment in a nutshell. I'm not going to go too much more into all that at the moment. So we'll go into the side compartments. We'll start with this one right here. Okay, this compartment here, I have something in here, and I'm going to bring it to you guys' attention in a minute. Do not use medications or antibiotics if they're not designed for human consumption. Okay. That being said, I have in this compartment right here are fish antibiotics, fish ciprofloxacin, fish amoxicillin, and I can't remember the other one offhand, but I'm not pulling them out. But that's what those are. Anyway, in here I keep cotton balls. I keep cotton rounds. These are some long, basically giant Q-tips, the sterile applicators. Okay, regular size Q-tips. All right. Now, like I've said in the past about lots of gauze, keep lots and lots of gauze. These are 4x4s. All right, I keep 4x4s, 3x3s. These are, what are these? These are 2x2s. Okay, these are actually 2x2s. These are IV sponges. They're a little different. IV sponges have like this little cutout here. Don't install or use IVs unless you know what you're doing. All right, that's that pouch here. All right. Yeah, in case you guys want to see them, I'll show them to you anyway. Again, don't take anything that's not labeled unless it's labeled for human consumption. Okay? These are some fish antibiotics. I have consulted with a pharmacist in the family about them, but you should not take them. I'm not telling you to take them, nor should you take them. Okay? So get that out of the way. I'm not giving anybody advice and things to do that they shouldn't do. All right? Just showing you what I got in my bag. That's simply all I'm doing. This side here, okay, I keep one of these cheap-ass Harbor Freight lights because they are good for working in the dark and they're magnetic. I do keep these right on the top. Antibacterial hand wipes. Okay, I keep a pack of what I call OTC meds, which is NyQuil, Dayquil, Gas X, Alka-Seltzer, Advil PM, Tylenol, aspirin. If you can keep any of that stuff, make sure you keep an eye on expiration dates. This is lubricating jelly. Okay, use that for lubrication. I don't think we need to get into that much more. I keep individual packs of sterile latex gloves. Okay, I keep hot and cold packs in here. This here, I'll show you guys what this is quick. This little pouch here. This little pouch here contains medical shears, thermometers, tweezers, all that kind of good stuff. Okay, that's what's in here. Here's got the over-the-counter creams. You know, hydrocortisone cream, anti-itch cream. Hydrocortisone anti-itch cream, an antibiotic cream, a couple more packets of lubricant, you know, Vaseline. These here are a little bigger bottles and stuff. There's also some nasal spray, allergy medications, stuff like that. Okay, so you see what I got in there on the inner pouch inside here. All right, this is where I keep emergency blankets. You have to deal with a hypothermic situation. Keeping the emergency blankets. I keep hand warmers in here. Okay. And over here, this is a big pack of Band-Aids. Do I really need to pull those things out? I think you guys know what Band-Aids are. I don't think I have to do that. And I keep a pack here of Quick Clot and Celox, however you pronounce it. All right. Again, Celox, blood stop, Quick Clot, any of that stuff. Learn how to use it before you use it. Okay, know what needs to, how to irrigate it out. If it needs to be irrigated out, have a plan to get it irrigated out. A lot of that stuff cannot stay inside a wound forever. It's there for an emergency situation. Keep that in mind. All right. So let's clear up a couple questions in case people want to bring it up. All right. What don't I have in here? I don't have a rat or a cat tourniquet. I don't have Israeli bandages. Now, why don't I have them in there? Well, I'll tell you why. Like I said a while ago, this is a kit, stays in the truck. And it comes with me from A to B, and it comes out in case I had to go in an auxiliary bug out location that I could treat most minor to major injuries with what I have in here. Okay? So, I'm going to explain to you why I don't keep a Israeli bandage or the tourniquet systems in here. The reason I don't is because I have them in my bug out bags and I have them in the glove box in the truck, and I actually usually carry them with me in my EDC. So I don't have them in here. I don't need to have them in here. I have them in the vehicle, in my bug out bags, usually on my person, and they are already in the places where I would go bugging out have them already. So I don't need them in here. I have more than enough redundancy with those that I don't need them in this bag. It makes sense to me to put them in there. The other thing I actually normally have in here that I chose to take out before we did this video are prescription antibiotics, prescription medications, things of that nature. For my own OPSEC reasons, I will not be showing you those, but I do normally keep them in here. I make sure that I have as much as possible of that stuff on hand. Something to keep in mind about antibiotics, medications, OTC medications, over the counter, any of that stuff. As you're keeping stuff inside a bug out vehicle, guys, keep in mind the temperature, extreme heat and extreme cold can damage or ruin some certain medications. So keep that in mind, as well as expiration dates. Know when you could use medications to. Know if you can use them past the expiration date, if you shouldn't. Keep all that stuff in mind. Don't perform any type of medical first aid that you're not trained to do. Life or death scenario, that's one thing, but don't do anything, that could hurt you or somebody else without knowing how to do it. All right. Again, I don't keep a minor surgery kit in here. I don't keep a suture kit in here. Why? Because I don't know how to perform surgery, right? I'm not a surgeon, so I'm not going to keep that in here. Plus, I have other people in my survival network that do know how to do that are EMTs and that are trauma nurses that know how to do those type of things. From family to friends in my little group that know how to do that stuff, so I'm not going to keep that in here. That's not my specialty, nor all I would end up doing is hurting somebody else when I'm trying to save them, and that's not what you want to do. All right. I think that covers just about everything. I keep trauma kits everywhere, like I said, so this is not a pocket-sized trauma kit. This is a full med kit for anything I need. Why don't I have a blood pressure cuff and a stethoscope? Look, I can't carry everything. You can't carry everything. If I carried everything, my whole truck would be filled with medical supplies. So you can't carry everything. I take with me what I think is the priority to have. All right. There's also some other things that I didn't, because I didn't pull it out. In the bottom of here, I keep little packets of sugar, smelling salt, stuff like that I have in there. Ammonia inhalants. There's some stuff in there that I didn't pull out, but I gave you guys a general idea of what's in the bag. All right. Hope that helps. Hope that gives you guys some ideas. Please stay safe in anything you do. Stay safe. Stay strong. God bless the United States. And thank you all for watching. Have a great day.